So many of us have begun to see some flickers of light at the end of the tunnel with the COVID-related outbreak. But there's an old joke, and maybe not the greatest joke, about be careful when you see that light at the end of the tunnel. It might be the light of an oncoming locomotive. The Deadliest Enemy gave us warning, as well as a lot of other things, about the COVID outbreak. Many professionals who deal with public health issues have been waiting for the next 100-year pandemic. We've known it was going to happen. SARS didn't turn out to be it. MERS didn't turn out to be it. But they actually gave us a great warning. In fact, again, Michael Osterholm in his book predicted just this, that it was going to come from SARS and MERS, the coronavirus. The coronavirus has been endemic in the camel population after getting it from bat populations for years now, and that's not going to go away. He actually even quoted it in his chapter 13 of his book, Deadliest Enemy. Rudyard Kipling, and the dawn comes up like thunder out of China, across the bay. So what did we do with our warning from the Lancet magazine, the heroic healthcare groups in South Korea who warned us that this is going to happen again? Nothing much. We didn't develop other sources for masks, gowns. We didn't develop the test kits. In the whole month of February, we just sort of said, what did we do? That was a critical time period. And I have to admit, I did it as well. I was focused on our February 28th event. And people asked me, Doc, why don't you cover coronavirus? Well, we made our mistakes, me included. So what do we do when we make mistakes? Well, we always blame somebody else. And it's always very popular to blame leaders. But what if you're a leader? Well, if you're a leader, you blame other leaders. And so that's where we go. But there's been lots of bravery, innovation, great people. We're going to do some really good stuff. And we're going to emerge stronger as a culture. But we still need to wake up and smell the coffee. One of the patterns that we're seeing more and more and more is the increased risk. In other words, a lot of people are getting coronavirus, but it's COVID-19, the serious disease that's so linked to diabetes and prediabetes. Diabetes tops underlying conditions related to the Louisiana COVID-19 deaths. Why coronavirus is more dangerous for diabetics. Those with diabetes could suffer from coronavirus exposure. So here's the thing. We've really got a bigger pandemic going on and much more lethal than COVID-19, believe it or not. And it's the diabetes, prediabetes epidemic. You see, diabetes and prediabetes are the cause of heart attack and stroke by far, as in over 80% of them. Well, when you think about coronavirus deaths, as of last week, 40,000 deaths for the whole time period in the world, and it's going to increase, there's no question. But during that time period, just one of those weeks, that 2-month time period, almost 3-month time period, just one of those weeks, there were 30,000 heart attacks and stroke. In fact, when you start looking at how lethal cardiovascular disease is, we have a Vietnam War every 2 to 8 weeks. Why such a range? 2 and 8 weeks are not that close together. Well, it depends on who you count. For example, if you're just counting U.S. military casualties, that was 58,000 over the entire, decades-long Vietnam War. But it was much more than, many more lives were lost than just the U.S. military. Tons of civilians, South Vietnamese civilians, North Vietnamese civilians. France was involved in this. Many other countries were involved in this war. When you include all of those, it was a little bit longer. It was 8 weeks. So our U.S. military were about 1/4 of the full thing. So even when you consider the entire world's population, we still have a Vietnam in the U.S. alone for the whole world every 2 months. Cardiovascular disease is lethal, and we're not even talking about the fact that it's also the #1 cause of disability, the #1 cause of blindness, the #1 cause of some other problems too. With COVID, we've been focused on pangolins, bats, cruise ships and their problems, treatments, quercetin supplements, zinc, hydroxychloroquine, aerosol versus droplet transmission, vitamin C, whether or not Harvard does a good FAQ, mass testing quandaries, how are we going to access personal protective equipment? Meanwhile, people are still dying from diabetes and prediabetes. And it's not just from COVID. So here are the three big maps. This is maps from heart disease on the left in the U.S., maps from stroke deaths on the right in the U.S., and maps for COVID in the middle. Again, diabetes is the underlying risk here. Heart attacks, strokes, and now COVID are the grim reaper. They're the things that are causing the final death. But people that don't have prediabetes aren't having problems with any of these. But wait a minute, I'm including prediabetes? Why would I include that? Why have I been banging that drum? Well, people think I've only got a touch of sugar, I won't have a problem until I get full-blown diabetes. Not at all true. That's one of the things I keep trying to bang that drum about. Just ask and look up the policies for the American Association of Clinical Endocrinologists and look up the science. At least a third, maybe closer to a half, of people already have the eye disease, which causes blindness associated with diabetes, before they even get a diagnosis of full-blown diabetes. It makes sense. Prediabetes is the same disease as diabetes. It's just considered to be a lower level. You haven't met certain criteria, but you've got the same disease process. So just like the CDC says, as much as you may want to bang on them about test kits and other things, they're right when they say, don't let the pre in prediabetes fool you. Prediabetes is a serious health condition. It leads to heart attack, stroke, regular full-blown type 2 diabetes, a lot of other things. And you know what? They used to think that there were 84 million people with prediabetes in this country alone. Only about 8 million people knew that they had it. 9 out of 10 have no clue. And then they started finding from other studies that 84 million, or 1/3 of the adults in the U.S., is probably low. Really? Yes. With the UCLA study, they found that it was over half. And they also found, look, this is not a disease process that waits till we're 50 or 60 to hit us. This is over 50% of us, over half of us, starting at age 30. So again, far more prevalent, far more common disease process than we've ever known, and at least 9 out of 10 didn't know it before we found out this other huge group of people that have it. Now, how does it do that? Here's what happens. If you look at it burns our arteries. And burned arteries can cause a heart attack and a stroke. Here's a normal artery right here, and here's an artery that's been burned for many years, and it's releasing stuff, what we call hot plaque, out into the bloodstream. And when it does that, that hot plaque, when it's released, can cause a clot. If the clot's big enough and it goes to the heart, it causes a heart attack. If it's big enough and it goes to the brain, that's called a stroke. Now, what causes this plaque to get laid down more and more and more in the first place? You guessed it. Routinely having hour after hour of a blood sugar that's too high. And people start looking for it. They start finding, gosh, I thought my blood sugar was normal. So did my doctor. Because we were looking at fasting blood glucose and hemoglobin A1C. Not the greatest measures for this problem. We need to look deeper. But you start seeing, as you look through the arteries of people that have died with heart attack and stroke, you see this muscle layer here, and then you see that lining. But then you begin to see, oh, all this plaque. And guess what? Our own immune system attacks that plaque, and when it does, it forms that hot liquid plaque. And when that hot liquid plaque goes back out into the artery and touches flowing blood, that blood stops flowing because it forms a clot. Just like this clot that formed in this artery. The majority of this clot is up in the heart, in this dead patient. That's what killed him. So, yes, some of us are starting to see a light at the end of the tunnel of the COVID pandemic, but let's be careful and think about it. Maybe that's just that next version of the prediabetes pandemic. Thank you for your interest. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.